الأستاذ المساعد الدكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم والوجه والفكين. Our lecture today المحاضرة لهذا اليوم راح تكون dental management of patient with ischemic heart disease. First of all, let us give some idea about the ischemic heart diseases. Actually, ischemic heart diseases, these are group of diseases, and these group of diseases usually occur due to ischemia of coronary arteries. So, since there is ischemia of the coronary arteries, there is either contraction or necrosis of the myocardium or the muscle of the heart. So, the most common causes of this ischemia of the coronary arteries, actually, it is due to atherosclerosis of coronary artery. So there is atherosclerosis and there is narrowing, then ischemia and necrosis or contraction of part of the muscle of the heart. However, there are also other causes that may lead to ischemia of the coronary arteries and subsequent necrosis or infarction of the muscle of the heart. In this condition, actually, there is imbalance between the O2 supply and O2 demand. The heart, during working, needs O2. So in this case, since there is ischemia, that means the amount of blood reaching to the heart is not adequate. So in this case, there is imbalance in the O2 supply and demand and O2 demand. Actually, this group of disease, can be classified into angina pectoris and also myocardial infarction. Angina pectoris can be further subdivided into stable angina and unstable angina. In case of stable angina, usually there is severe chest pain and there is no changes in the duration and severity of the attack. Usually the patient aware of this condition because usually the attack comes during eating, exercise, emotional stress, and so on. And usually it can be relieved by rest or medication. While in case of unstable angina, usually there is progression in the frequency of the attack. And also there is, or the attack or the chest pain cannot be relieved by rest or medication. So there is differences, variation between the stable angina and unstable angina. Unstable angina, actually, it is more risky because may lead to development of myocardial infarction. So here, the complication actually of these diseases, I mean ischemic heart diseases, could be may lead to congestive heart failure, as shown here. Congestive heart failure, which is one of the complications of this disease. Actually, the predisposing factors of atherosclerosis could be hypertension, diabetes mellitus, hyperlipidemia, cigarette smoking, and so on. So here, we want to discuss why these diseases are important for dentists. Actually, the dentist should be aware of the patient with ischemic heart disease because the anxiety and stress of dental procedure may exaggerate the condition or may aggravate the condition. In addition to that, vasoconstrictor and the local anesthesia also may affect the heart or increasing the palpation or may lead to tachycardia, and this is also may lead to aggravate the condition or may lead to predisposing factors of the attack as well. In addition to that, some of those patients, I mean the patient with ischemic heart disease, may take drugs, anticoagulant or antiplatelets, and this actually may lead to bleeding during tooth extraction or even after tooth extraction. So for this reason, dentists should be aware of this condition. So what are the signs and symptoms of patient with ischemic heart disease? These are central chest pain. However, the pain may radiate to the upper arm, particularly to the left side, upper arm, or even to the wrist, even to the lower jaw, to the palate. So for this reason, also the dentist should be aware of this of the pain due to angina or due to myocardial infarction, because sometimes even in the lower jaw, in the mandible, there is no affected tooth, there is no decay, but there is pain. So in this case, the pain may be referred or radiated from the heart. Dyspnea, shortening of breathing, also palpitation, tachycardia, syncope or loss of consciousness, and also actually the condition, there is differences between the myocardial infarction and angina regarding the chest pain. In case of angina pectoris, the pain may maybe last for 3 minutes, while in case of myocardial infarction, usually may take 15 minutes. So this is maybe used to differentiate between the attack of angina and the attack of myocardial infarction. Generally speaking, these sinus symptoms or the clinical manifestation of ischemic heart disease could be few or milder, but sometimes, sometimes there is no sinus symptoms, but sometimes the sinus symptom becomes more clearer. These sinus symptoms become more clearer in case of the development of congestive heart failure, which is one of the complications of ischemic heart disease. So in this case, there is more clear sinus symptom. We can see the veins of the neck becomes more. The veins of the neck become more distension neck veins, and also ascites, sometimes also cyanosis. So these are another manifestation related to congestive heart failure. What are the medication for the treatment? This is medical treatment of patient with ischemic heart disease. Usually the patient might give him nitroglycerin, which is vasodilator. This is in the form of oral tablet, or could be sublingual tablet, or could be in the form of gel or ointment. Beta blockers, since the patient may have palpitation or tachycardia, so people may give also, physician may prescribe beta blockers or even calcium channel blockers. Actually, these drugs actually for antihypertensive, but also could be used in case of ischemic heart disease. Ranolazine, actually, one of the anti-anginal drugs, also could be used in the treatment of the severe pain of angina pectoris, and it is called anti-angina. Antiplatelets like aspirin or clopidogrel or anticoagulants also could be given, because the main cause of ischemic heart disease is ischemia, so there is thrombosis of the coronary arteries. So in this case, the physician may prescribe anticoagulants or antiplatelets in order to make the blood more thinner and to decrease the fluidity actually of the blood to prevent coagulation or thrombus formation. So what is the dental management of patient with stable angina? As I mentioned before, patient with stable angina usually aware of this condition, because the condition usually comes during exercise, during eating, during emotional stress, so could be relieved by rest or even by medication. So how we can manage those patients? First of all, short midday appointment, early afternoon. This is actually in order to, if the appointment evening or late evening or even in the evening, in this case the patient becomes fatigued. And even in the early morning, people found that usually the cardiac attack or cardiac standstill usually occurs during early morning. For this reason, the proper appointment for those patients with ischemic heart disease, it should be in the midday or early afternoon. Dental care should be in semi-supine position, because usually the patient complains of dyspnea, shortening of breathing, so the chair should be in semi-supine position. Check vital signs. Vital signs, blood pressure, pulse rate, and even breathing rate. This is also very important. An anxiety protocol can be used, like benzodiazepam, could be at bedtime or could be 1 hour before dental appointment, and usually 5 milligram benzodiazepam can be given. Nitrous oxide inhalation also can be used as well. Patient should be advised to bring his hair and medication. Actually here we mean nitroglycerin, because nitroglycerin, sublingual nitroglycerin, could be given as prophylactic. For this reason we can say administration prophylactic nitroglycerin sublingually in order to prevent the attack during dental procedure. Use plain anesthesia. Actually, plain anesthesia here, that means the anesthesia without vasoconstrictor. Because the vasoconstrictor usually used in local anesthesia may affect in the heart, adrenaline or not adrenaline. So in this case, it is better to use plain anesthesia, that means anesthesia without vasoconstrictor. Avoid gingival retraction cord containing epinephrine, because if the gingival retraction cord contains epinephrine, in this case epinephrine might be absorbed through gingiva, and even this is may affecting the heart as well. Avoid anticholinergic drugs. Anticholinergic drugs such as atropine and scopolamine. These drugs may increase the heart rate, and this is actually may burden the disease or may exaggerate the condition because already the patient may have palpitation. So in this case, this is very risky. Aspirin may cause local bleeding. We have to avoid also aspirin because, as I mentioned before, this may lead to increased bleeding. Pre-treatment checking of prothrombin time and international normalized ratio. Actually, prothrombin time measuring the extrinsic pathway and even international normalized ratio. So this is in order to convert the patient to more normal condition. Discontinue and schedule the appointment when patient becomes fatigued, and general anesthesia should be avoided. So this is in case of stable angina. In case of unstable angina or MI, elective dental treatment should be postponed. That means usually the patient with this condition can be given dental management after 4 to 6 weeks or even more than 6 weeks, depends on the condition. Pre-treatment at home, we have to give the patient anti-anxiety protocol, I mean benzodiazepam. This is to reduce the stress during dental appointment. Long-acting dermal application of nitroglycerin, because dermal application gives long action, so for this case we can give the patient from home. Pre-treatment at dental clinic, check vital signs, blood pressure, pulse rate, and so on. Establish intravenous line, this is in case we need benzodiazepam IV. Sublingual nitroglycerin to prevent angina attack during dental treatment. This is actually in order to prevent prophylactic. During treatment, use nitrous oxide inhalation as sedation, check pulse rate. Benzodiazepam intravenously should be given in order to calm the patient, to reduce the stress and anxiety. Prophylactic nitroglycerin sublingually also if the attack comes during dental treatment. The procedure should be pain-free and very important, and this is by using plain anesthesia. Patient who develops chest pain during dental procedure or on the dental chair, the patient might develop chest pain. In this case, we have to stop dental procedure. We have to give the patient 1 tablet nitroglycerin and sublingually, and we have to wait for 5 minutes. If pain disappears, either continue the procedure or postpone. If pain does not disappear, we have to check the vital signs, blood pressure and pulse rate. If the condition is stable, give him another tablet sublingually and wait for another 5 minutes. So in this case, we have 2 tablets and 10 minutes after giving these 2 tablets. If pain disappears, either postpone or continue the procedure. If pain does not disappear, then check the vital signs again, and if the condition is stable, give him or her another sublingual tablet. So this is the 3rd tablet, and wait for another 5 minutes. If pain disappears, either postpone or continue. If pain does not disappear after 15 minutes of giving 3 tablets nitroglycerin, in this case, myocardial infarction is more likely happening or should be suspected. We have to call the ambulance and to transfer the patient to an emergency unit. So this is the end of the lecture, and thank you